protein is one of those things that should stay and not get out into the urine. If you start having protein in the urine, that means that filtration system is starting to break down. And that can happen because of inflammation of lupus. And that's really a signal that we need to be looking closer.
Welcome to Unmasked, Life with Autoimmune. I'm your host, Ash from Ash Fights Lupus, and we're here to rewrite the rules. Let's get to work. Unmasked. Hey, Dr. Blazer.
Hey, Ash, how are you?
I'm doing well. Hi, everyone. I wanted to thank you for joining this conversation. This discussion is actually on lupus nephritis. This session is provided by the Vindico Medical Education, and it's supported by the educational grant from Genentech, a member of the Roche Group. So my name is Ash Thompson, also known as Ash Fights Lupus across social, and I've been living with lupus for more than a decade now. Wow, I'm aging myself. But today we're talking about something that many lupus patients may not realize can affect them, which is lupus nephritis, also known as lupus kidney disease. I'm joined by the beautiful Dr. Ashira Blazer. Dr. Blazer, thank you so much for being with us. Will you introduce yourself for me?
Yes, of course. Thank you so much for having me. So I'm Dr. Ashira Blazer. I do lupus all the time. So I take care of patients with lupus. I research lupus, and I am the co-director of the Lupus Center at the University of Maryland, Baltimore.
Wow. So any specific reason why, you have decided to save us lupus patients?
Yeah, so it's because lupus is in my family. So when I was in medical school, one of my really close first cousins developed the symptoms of lupus while I was studying lupus for the first time. And I ended up being able to get her to care with my professor. And I just learned about my own family history, how it affects especially women of color. And it was something that I wanted to dedicate my life to helping.
That is so great. I love to hear that. I actually am, I think they call it patient X. And so the only person in my family with lupus. And so I immediately just thought to myself, oh boy, I better find somebody else who knows something. And so that's wonderful that that lupus patients have resources like you. That's super cool. Okay. So I have a question that has really been burning in my mind. When I was first diagnosed and I have SLE, I'm not even going to try to pronounce that correctly, but I call it systemic lupus. So lupus kidney disease was not one of the things that was mentioned to me, or even a symptom, to, stay on top of. Do you know why that is?
Yeah. So unfortunately, sometimes the communication isn't where it should be, right? We really should be talking about lupus kidney disease with every person who's diagnosed with lupus, because it can affect up to half, even 60% of patients who have lupus. And it's something that is a major cause of shortened lifespans or even living with disability with lupus. So it's something that we have to be talking about. We have to be screening for, because the difference between a treated lupus kidney disease and an untreated is really worlds apart.
Okay. So that is true. I've heard, like, just from the comments on Instagram and things like that, that my medication and treatment is entirely different than someone else who is in a different region or even a different country. And so I'm really learning that every time I pick up something, I'm on the phone with the rheumatologist or with his nurse. Hey, I noticed this is this, and like, yes and no, right? This could be something that affects you, so that's why we're watching. Or, no, this isn't necessarily something we should see from lupus, but it's lupus, so we'll just keep our eye out, So one of the things I wanted to ask, and I have a few notes here. When we're lupus patients, we're already dealing with like the swelling and other symptoms, right? I think one of the things that interests me most is there could not be a symptom, right, for kidney disease. Can you tell me more about that?
Yeah, I tell my patients this all the time. No one has a kidney attack, right? If lupus is affecting your kidney, you may not know. There are some symptoms, but they tend to be a little bit later after it's been going on for a while. So I always say it's something similar to the way that you would get a mammogram every year. Even though you can do a self-breast exam at home and you might find a lump, by the time you find a lump, you've really been affected for a while. So you have to do that screening test up front to make sure that you're picking it up early. Same with lupus. You need to be seeing your rheumatologist. You have to get those screening tests because you may not know, especially early on, and treatment is going to be alleged early.
Okay, that makes so much sense. So when we talk about who, outside of lupus patients, is there anyone else, like in the lupus community that may be more at risk, and is there a reason why?
Lupus kidney disease is something that is very common in people who already have systemic lupus, but there are actually some people who get lupus kidney disease as their first diagnosis of lupus, right? And so it's something, the screening tests are actually pretty common. So blood pressure checks, really important. Making sure you're getting your kidney function checked, making sure someone's taking a look at your urine and determining if there's too much protein in your urine or abnormal cells in your urine. Those are sort of the upfront screening tests. And then if we find that something looks abnormal, we can look a little bit further at the kidney directly.
Okay, so I want to ask, when I go to the rheumatologist, bless his heart, he wants all the panels, right? I don't even know what that means, but can you tell us specifically the type of test and what it's called? Like, if this is my first time hearing about lupus nephritis and I already have lupus, I'm headed to the rheumatologist, right? What words can I, use to tell the doctor that, hey, just found out about lupus nephritis, anything that I need to be worried about?
Yeah. So first of all, I'm sorry we order so much tests as rheumatologists.
What is that?
I order all the tests because I want to know. I order all the tests. I'm sorry. But when you're specifically talking about lupus nephritis, so I'll put this in buckets, right? So first is blood pressure. So when the kidneys are injured, the kidneys really control your blood pressure. So one of the first signs can be suddenly your blood pressure is much higher than it has been before. That's something that you can actually check yourself at home, right? But every time you go to the doctor's office, they should be checking your blood pressure. The other is for lupus activity. So there are certain lupus blood tests that don't change no matter what. Like you have a positive ANA, you'll always have a positive ANA. But there's some subsets like the double-stranded DNA test that can come up when lupus is more active, especially when there's lupus nephritis. And then there's the complement levels, which are these immune proteins that are made by the liver. And those actually fall down when lupus is active, especially when you have lupus nephritis, right? Now, the next thing you want to look at is the function of the kidney. Are your kidneys filtering appropriately? So you can learn that by doing blood tests, looking at the creatinine number. So that number can go up whenever your kidneys are not functioning as well. And then you can actually look at the filtration rate called the glomerular filtration rate, or GFR. And that number comes down when the kidneys are not functioning correctly. Ideally, we pick up lupus nephritis before those numbers are affected because we don't want your kidneys to not be functioning well when we're treating. But those are numbers to be looking at. Now, the number one thing that we look at is there too much protein in the urine, right?
Right.
So if you think of your kidneys as a filtration system, there are certain things that should get out into the urine and certain things that should not get out into the urine, stay in your blood. Protein is one of those things that should stay and not get out into the urine. If you start having protein in the urine, that means that filtration system is starting to break down. And that can happen because of inflammation of lupus. And that's really a signal that we need to be looking closer.
Okay. So one of the things my doctor loves to do, and I'm so grateful that he does, is after he's ordered it, he really will sit there and say, hey, this was to see this and this was to see this. And that's one of my favorite things, right? Because sometimes as a lupus patient, you're getting so much information, right? And it's all important, but which one do I need to have written on the clipboard and looking at every day, right? So my question really is, what's one thing that you wish every lupus patient knew about practicing kidney health?
Okay, I would say know your numbers because trends matter, right? So, for example, I talked about that protein, right? There are some people who have had lupus kidney injury and their protein never really returns back to normal, right?
Wow.
And so we would like everyone's protein to return to normal, but sometimes it doesn't, right? So you should know what your new normal is. So if there's a departure from that, you're able to talk with your doctor. Also, your doctor should know this, right? These are things that sometimes I have a little existential crisis about, right? Because it's a lot to put on a patient to tell them to track all these things. But
Yeah.
if we're honest, it's important for you to understand. So that's one thing. The other is blood pressure is so, 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 so important. Okay, I think that's my one thing. All right. You said one thing. That's my one thing, right? So yeah, let's circle back to that. My one thing is blood pressure is so important, right? Blood pressure can be your first indication that you have a problem with your kidney. Once you're going through therapy for lupus nephritis, blood pressure being normal is going to help protect your kidneys, right? So you can check that at home. You can check it multiple times a week. If that's something that's off, make sure you're advocating to get that control.
Okay. Okay. I think I have a little bit more. Well, just one more question, if we have a little bit more time.
Yeah.
So really, if for someone who feels completely fine right now, what would you want them to know about the importance of routine monitoring? Or even so, can you give them a tip on how to monitor, from home? Like you said, you can do the blood pressure, but is there anything else that I should be paying attention to from home that I can do?
For sure. Yeah. So we said that most people don't have symptoms when they develop lupus kidney disease, but some people do, right? And those symptoms can be not just the blood pressure, but you wake up in the morning, you notice your face is a little puffy, especially around your eyes. That can be a sign that lupus may be affecting your kidneys. Or if you start to notice that you have tight socks on, they leave an imprint in your leg, or you have some swelling on your legs, that can be a sign that lupus is affecting your kidneys. So if you start having any of those symptoms, or you wake up in the morning, the first time you go to the bathroom, there's a froth on your urine, kind of like foaminess on the head of a beer, right? That is a sign that lupus could be affecting your kidney. If you notice any of those things, definitely talk to your rheumatologist.
Okay. Wow. I really feel like you have given me so many more things to think about, but also in a not scary way. And I appreciate that. Sometimes lupus is a little daunting. And so being able to, have conversations with doctors that help us, that research with us, it's wonderful. But before we go, I wanted to ask, do you have any questions for me?
Yes, I do. Okay, so what advice would you give for a lupus patient who is newly diagnosed with kidney disease, who feels completely overwhelmed?
Oh, let me tell you, therapy, right? So one of the wonderful things, I go to my rheumatologist for anything. So, hey, doc, I'm feeling as if I'm overwhelmed. Let me find you a friend of mine in this field. Hey, doc, I feel like I'm losing. There we go. I feel like I'm losing hair. Let me send you to a dermatologist in my field. And essentially, it's just going to your point of information, right? And asking for additional resources can really help with that feeling. And what I mean by that is you're overwhelmed because you're thinking of the unknown. But having a conversation helps to ease that, because just like we're talking with you, you're giving us, different things to pay attention to, but also I know a little bit more about the testing. I know a little bit more about what you're looking for, and I know to stay on top of it. So I would just encourage them, go to your rheumatologist, not the Google, not other places. Go back to your, source of information.
That's awesome. That is fantastic advice. Thank you.
Okay, so just want to wrap this up. Dr. Blazer, thank you so much for sharing your expertise and for helping us just better understand lupus nephritis and the importance of early detection.
Yeah, thank you so much for having me. I really enjoyed our conversation.